Hi, this is Andrea. I'm here with you for HIT 210 to talk about unbundling. What is unbundling? Unbundling is improper coding that occurs through unbundling or fragmentation. Medicare and Medicaid often have lower reimbursement rates for groups of procedures commonly performed together, such as incisions and closures incidental to surgery. Unbundling or fragmenting billing codes illegally increases a provider's profit by billing bundled procedures separately, which results in higher reimbursement from Medicare and Medicaid, which is fraud and abuse. Sometimes using EHR software for coding and billing facilitates upcoding and unbundling. You have to really watch it. With EHR software, providers can copy and paste notes from a patient's previous visit into each current treatment note, which can make it appear that the provider has diagnosed and treated every condition on that list. Providers might also restrict the menus on their EHR software to only show diagnoses and treatment codes with the highest reimbursement rates, so you have to really watch that. Unbundling is billing for procedures separately that are normally covered by a single comprehensive CPT code. CMS publishes what's called NCCI edits, or National Correct Coding Initiative edits, which are pairs of codes that should not be billed together. The goal of the NCCI edits is to prevent improper coding and fraudulent claims. Each NCCI edit signifies a pair of services or procedures that would normally should not be billed, both be billed when performed by the same provider on the same patient on the same day. In other words, the two codes in an NCCI edit are bundled together. Unbundling occurs when multiple CPT codes are used to report component parts of the procedure, either unintentionally or intentionally, to increase the payment. Some examples of unbundling include fragmenting one service into component parts and then coding each of those component parts as a separate service. Unbundling is also reporting separate codes for related services when one comprehensive code includes all related services. Unbundling is breaking out bilateral procedures when one code is appropriate and actually includes the procedure being done bilaterally. Unbundling is also separating a surgical approach from a major surgical service. Billing for a lesion, excision, and skin repair on a single service date would constitute unbundling and generate an NCCI edit. CPT coding guidelines say that simple repairs are included in the excision codes and should not be coded separately. However, if the repair was done on a different site from where the lesion was removed, then both procedures can be billed, but a modifier needs to be appended to let the payer know that the skin repair was separate from the excision. Different location, different procedure. In their bundling guidelines, and I pulled these from Blue Cross and Blue Shield because, again, most payers are pretty similar, but this was a really good example of a set of bundling guidelines. It says that services considered incidental, mutually exclusive, integral to the primary service performed, or part of a global allowance are not eligible for separate reimbursement. So incidental procedures, that's not eligible for separate payment on a claim. So for instance, if during a hysterectomy surgery, they remove a woman's asymptomatic appendix, you cannot bill for that because it was incidental. Mutually exclusive procedures. This is when you have two or more procedures that are usually not performed on the same patient on the same date of service. The provider should submit only one of the procedure codes. So an example they give us is that if you do an open procedure and a closed procedure in the same anatomic site, both are not going to be reimbursed. You want to code and bill the most clinically intensive procedure, which would be the open. Integral procedures are those that are commonly carried out as part of a total service and don't meet all the criteria under the policy multiple surgical procedure guidelines. So the example they give us is that when an orthopedic surgeon is doing a surgical endoscopy or arthroscopy, the diagnostic endoscopy, arthroscopy is always included, because when they go in to do, like, let's say they're scoping someone's knee, the first thing they do is go in and look around. Then they may do some shavings, or they may, remove some fluid, or they may do something like that. But they had to do the diagnostic piece in order to facilitate the surgery piece. So the surgery piece is the only one that gets billed because the diagnostic piece was integral. It was all part of it. It's always done. If all they did was go in and look around and they didn't do a surgical piece, then you would bill the diagnostic piece because they didn't do the surgery. But when they do the surgery, they've always already gone in and looked around in order to be able to know what they need to do for the surgical piece. Global allowance. Most medical and surgical procedures include pre-op, intra-op, and post-op services, and those are reimbursed on a global allowance. So you would not separately report or code or bill for pre-op, intra-op, post-op because that's all part of the op surgical package. So what are some unbundling examples that we can talk about that are permissible, that are okay? And I like these ones from the American Academy of Ophthalmology. The first one is a patient has a pterygium surgery in the right eye. During the 90-day global period, the patient is hit in the left eye with a bungee cord, causing a traumatic cataract and vitreous hemorrhage. Immediate surgery is scheduled. The vitrectomy and cataract extraction are bundled. In this case, you can add modifier 59 to the unbundle since it was known preoperatively that the patient's going to need both procedures. And you add it to the 66984 because this is the secondary procedure and it's paid less. Modifier 79 needs to be added to indicate that the cataract removal and vitrectomy were unrelated to the pterygium surgery that happened on the right eye within that 90-day global period. So that's where you can unbundle, and you can use your modifiers to indicate that the pterygium surgery in the right eye, even though it occurred during the same time period that the vitrectomy and cataract extraction were done on the left eye, they were different surgical sessions and different eyes. And so you have that. And again, based on the diagnosis, you can add the 59 that both the vitrectomy and cataract extraction were done on the left eye. They're not typically done together, but because of the trauma and the damage, they had to be. All right, so there's some more examples here of a different surgery site, different procedure, and then some FAQs that I pulled up here that are helpful to kind of give you those examples. So I'll let you read through those and see what you think. Hopefully all of those make sense. If they don't, shoot me an email and we'll talk about it in class. All right, some tips to prevent unbundling. How can you avoid medical coding errors? Again, you have to be diligent. You have to be detail-oriented, double-check things, read everything over. Don't just slap a code on because that's the most common thing that you do. Make sure that you're reading for each patient separately, differently, those types of things. Make sure that you're talking with your provider and that you have a positive relationship there, and that they know what you're looking for so that you don't have to ask them to keep clarifying something. And explain why you're asking for it and what the difference can be, both in documentation terms, in data terms, and in reimbursement terms. And then make sure that as a coder you stay up on things. Make sure that you know what's changing and how it's changing. And that is it.